Welcome back. March 31st is the enrollment deadline to sign up for health insurance under the Affordable Health Care Act. After March 31st, Americans without health care plans will have to pay the Obamacare penalty. Joining us now to explain it all, John DiVito, president of Flexible Benefit Service Corporation. Thanks for coming in.
Thank you. Thank you for having me.
So why don't you start by saying, if people do not have health insurance and they miss the March 31st deadline, what happens to them?
Two really important things. Number one, there's going to be a fine that they'll be faced with, and that fine is going to be 1% of their total income. So if they're an income earner of $50,000, they're going to pay 1% of that, or $500, and that will come right out of their tax returns next year. The other provision is that if they don't buy insurance by March 31st, they can't buy insurance at all for the rest of the year. The carriers won't sell it to them, and the bottom line is the only policy that will be available to them will be short-term policies, and in that case, you'll have to be medically underwritten, and you could be declined. Today's policies that are going into effect for either March 15th for an effective date of April 1st, or you need to secure a policy by 3/31 or March 31 for a 5/1 effective date. Once those dates pass, that's it. There is no longer the ability to buy insurance unless there's a family.
Say those dates again for us.
So it's going to be for March 15th. You need to purchase a policy by March 15th for April 1st. And then the next most important date is going to be March 31st for an effective date of May 1st.
Otherwise, you'll be shut out of insurance totally.
Correct, unless there's a qualifying event, you know, a marriage, a divorce, a birth, things of that nature, you can then purchase it. And if you have lost your job, outside of that, it's closed. And so until the next open enrollment period, which will be on November 15th, and the latest provision as of yesterday is now going to be extended to February 15th for the year of 2015.
And is this just for the government insurance?
Well, it's for all policies. So, you know, the way that people are viewing this, and I think there's some confusion with this is straight up individual health insurance policies sold by the insurance carriers. But the provision is that you need to secure it by certain dates, and if you don't, you have a fine and you have a penalty.
There have been a lot of problems reported about the technical problems with some of these websites. What are you hearing now, John, about how smoothly it is, how easy it is for people to sign up?
It's still glitchy. There are still issues, but that shouldn't discourage people from shopping. So if you did go on the site a month ago or 60 days ago and found that you couldn't qualify for a subsidy, you couldn't secure a subsidy, our suggestion is go ahead and buy the insurance policy. You can buy a policy and you can always cancel your policy, right, up until the 31st of March, but you cannot buy a policy after that. So what we're telling people is secure the policies, and then next year when you file for your taxes, show the proof of coverage, and they'll actually give you a refund should you qualify for a subsidy.
So do it early just in case.
Absolutely.
Now we want to ask you about the news that just came out this week, the rewrite that said people can keep their old plans longer, their old insurance plans longer.
So, you know, today's policies are in force, and those are all standard major medical policies. Many of those policies did not qualify under ACA.
Does that mean they're bad plans?
No, it does not. Those are very good health insurance plans. They just didn't qualify. There's certain provisions in there, infertility,
give us an example, yeah.
Emergency room benefits, things of that nature. So those didn't qualify. Those are the ones that you can continue on. But the real message today is, how do I get coverage? We've built a landing page, shopgetcovered.com, and what we did is 3 important points in there. We show the penalty, we talk about the subsidy, and we have a calculator, and third most importantly is we ask you to shop online. So people need to shop.
Thank you so much for breaking it all down for us, John. Yeah. For more information, you could check out shopgetcovered.com. John DiVito, president of Flexible Benefit Service Corporation, thank you so much for joining us. This is a lot to sort through, so thank you so much.
Thank you.